Charlie, welcome back to my channel. Today I'm going to be doing a dental nursing back to basics video. So pretty much everything that I experienced when I very first started training as a dental nurse and what you should expect to experience. This is just going from my opinions, my experiences. Yours might be slightly different, but it's just the general thing which you experience when you first start training as a dental nurse. So if this is something you're interested in, then just keep watching. So I'm just going to jump straight into the video and give you kind of a background of my dental nursing years. I've been qualified for almost 3 years now and doing the job for, it will be 5 years this September. Now the way I got the job, I get this question quite a lot, how did you get into dental nursing? I have covered this in another video, but just to clarify again, it was through some family friends. He was a dentist, his wife was the practice manager. I actually ended up doing it for my work experience, fell in love with it, and I kept saying, if anything comes up, please let me know, I really want to do this as a job. When I turned 18, it was the year for me to leave school, and in the summer of 2014, the practice manager, who was our family friend, came to me and said, there's a job opening up, would you like it? And I started that year in the September. Now I thought I'd just be chucked straight in with nursing, suctioning, doing all of that, but you need to have your inoculations done first. So you absolutely have to have your hepatitis B injections. So you can start nursing and suctioning after your second Hep B injection. Not after the first, it has to be after your second. That's what it was when I started training. It may be different now. Sometimes I do get a few messages on Instagram saying, that's not right, this is the right thing. I'm sorry if I give any false information. I'm just going off of my experiences. And at the time, it was after your second hepatitis B jab that you could start nursing and suctioning. So the first few things that I did was learn the computer system. That is obviously something you absolutely have to know because you are the person that sits and does the notes. You may not do the notes, your dentist may want to do it, but you need to have a general idea of how the computer works and how the system works. So that was the first thing that I trained in, was getting used to the computer system, learning what each of the individual things meant. For example, when you see a tooth chart, you have different services of the tooth. I'm not going to run into all those details. If you want me to do a video on that, then I will. But just generally, you have the mesial, distal, occlusal, palatal and lingual surfaces. So 5 different surfaces. So you need to learn them so that you know how to chart when you have a new patient or just when a patient comes in and the dentist goes through all the charting. So anybody that wants to know, when they're saying 8, 7, 6, 5, 4, 3, they're counting your teeth. When they're saying things like amalgam MO, it means you either have an amalgam filling on the mesial occlusal surface of whatever tooth it is, or you need an amalgam filling on the mesial occlusal surface of whatever tooth. They say upper left 5, lower right 6, whatever that may be. So that is the first thing that I was doing, was learning the computer system. Once I was familiar with this, I then learned about the instruments. So at this time I couldn't do any suctioning or nursing because I'd only had 1 hepatitis B injection. So to learn all the instruments, and I will do a video covering this as well, I went into the decontamination room and watched the nurses work in there and learn what each thing was. So filling trays, for example, have a certain amount of instruments on. Every single practice will have different types of filling trays. My first practice was different to my second practice. You still have a filling tray, but it has maybe 1 less instrument on or 1 extra instrument on, something different. Generally, they're all the same with a few little tweaks. So to move on from the learning bit, I then started nursing after my second injection. So I started with the hygienist, because all that you need to do with the hygienist, or at least all that the nurses did in my practice with the hygienist, was just suction. I mean, obviously you need to set up and clean away, but you don't need to pass her anything because she has it all on her side. I was just suctioning, and that got you into how to do it, where you need to place a suction in the mouth, everything like that. When the hygienist wasn't working, I was put in surgery with the dentist, not on my own. I always had somebody else with me until I said, yeah, I feel ready and confident, until I'd done every single treatment that there was to do, and then I said, okay, I feel confident I can do this on my own now. So when I was in with the dentist, I would be the nurse, and then the qualified nurse would be also in the room telling me what to do. I find it a lot easier to do something than to sit watching it because I'll probably forget it, whereas at least if I do it, I've done that thing, if that makes sense, and then I'll remember it a bit better. So when I was in with the hygienist, I was suctioning. I pretty much was doing the hygienist almost on my own after maybe the first or second day, can't remember exactly, but because that was just suctioning, it was a very easy routine to get into. When I was with the dentist and we were doing, for example, a filling, you would obviously need to suction, and then whichever material filling you would do, he would ask for certain things and then I would pass them over. When you're doing a checkup, I was sat at the computer and I was doing the notes. I was also charting the teeth, so again it's remembering all that you've learnt from that, and that is pretty much the basics of what I did when I first started training as a dental nurse. So aside from the learning and doing it, I also needed to start my college course. Now, depending on which practice you go to, which course you're doing, it may be slightly different, but I pretty much started it straight away. I guess the aim is to get you qualified as soon as possible. Now, this is something that, because every course is different, unless you do the specific one that I did, it's really kind of difficult to talk about exactly what you're going to do in that course. You really need to look it up, speak to the college teachers to find out exactly how that course is structured. But for me, what it would be is you go to college one evening a week, and then you had to do a workbook on whatever subject you covered in that week, and somebody would also come into practice to watch you. I know that some courses you have to go to somewhere, they give you a scenario and you have to act it out. I didn't do anything like that, so it's hard for me to give advice about those kind of things because it's not something that I did. Something else that I used to do when I very first started training was take a notebook in with me to the surgery and make notes about each different thing so that I understood it a bit more. I also asked a lot of questions because a lot of the time when you watch something, you might not understand why something was done, therefore I asked why, and then it goes in. I have had a few messages saying, I'm really nervous to ask questions, what if I don't know what to do, what if I just stand there and they ask me to do something. A lot of this job is speaking to the general public. You have to be somebody that can talk to people. You can be shy to do the job, but you have to be able to ask questions. Because you're always talking to somebody, you need to have a little bit of confidence to be able to ask questions to people. For example, if the dentist uses a metal filling instead of a white filling, why he might do that, aside from maybe it's NHS and private. Sometimes you have to use a metal filling because you can't use a white filling. There's different reasons for that, the main one being that you can't keep the tooth dry enough to put a white filling in, because for a white filling to work properly, the tooth has to be completely dry. Sometimes this isn't always possible, especially if it's very deep. So it's about understanding things like that, why the dentist has decided to do one thing instead of the other, and why exactly you're using what you are. Now, just as a little side note, if you have recently started nursing and you find suctioning really hard, I hated it when I started because I didn't want to hurt the patient. My hands were a little bit shaky and I thought this is actually a lot harder than what it looks like. So if you feel like that, then you are not alone. Probably most people felt like that. It is really nerve-wracking because you're working on an actual person in their mouth. Don't be discouraged if you're nervous to do it, you don't feel like you quite understand it. I felt exactly like that. It didn't take too long to get more comfortable with it, but still a lot of the time when I first started training, I felt like I didn't really want to suction because I didn't like it, but you do eventually get used to it. Something else that I did when I first started training, this isn't for all practices, this is just when I had a bit of spare time, I wanted to practice mixing the alginate. Now, if you don't know what alginate is, it's the putty stuff that they use for an impression when they make mouth guard or dentures, anything that they need an impression for, you'll almost always use alginate for it. This is actually quite difficult to mix when you first start because it's either going to turn into a big gloopy mess or it's going to be dry and lumpy. The aim is to get all the air bubbles out of it that you can, make it a smooth mixture that sets quickly but not too quickly. If you use warm water, it's going to set too quickly, probably before you've loaded it into the tray. If you make it too cold, then it's going to take a long time to set. That's okay, it's better than it setting too quickly and you not being able to use it, but you want to try and get the right temperature of water and understand how to mix it properly. I just said to my manager when I had a spare 5 minutes, do you mind if I practice mixing my alginate? And she was like, no, that's absolutely fine. So don't be afraid to say, can I have a go at this? Can I try this? Another thing is if you just sit at the computer computer and you get used to it, figure out where everything is, maybe try practicing with the dentist. Just say, can we pretend we've got a patient in the chair and you chart and I'll try and do it. Every kind of scenario that you can try and do is really helpful. I think I've pretty much come to the end of this video now. I don't know what else to cover in it. Because it was quite a while ago that I started training, it's hard for me to remember exactly what I did, but I've given you kind of the basics. It's different in every practice, but that is kind of a general what you should expect. The last thing I will say as to a what to expect: it doesn't always run smoothly. You will probably run into a lot of running late, missing some of your lunch, running over at the end of the day. It's not always a smooth running system because you get emergencies, you get people that come in for a checkup, have a broken tooth and want it done there and then. You get people that complain a lot, you get people that ring up at 3 o'clock in the afternoon demanding to come in that day, and if you don't see them, they're gonna write a huge complaint. It's not always a smooth running day, so another thing to expect is choppy, changing, trying to get used to everything. You will probably get stressed within your first few weeks. You'll see that everything is a little bit choppy and it's probably not what you expected at all. It definitely wasn't for me. Even though I'd done it for my work experience, actually doing the job definitely was completely different to how I expected it to be. So anyway, that is pretty much it for this video. If you wanted me to cover it in a different way, please let me know. I've just done it how I experienced it and what I did. So I hope you guys enjoyed this video today. If you did, don't forget to give it a thumbs up, click that subscribe button down below, and I'll see you in my next video. Bye!